The views and opinions expressed on the Healthcare Advocate Show do not necessarily represent the views and opinions of Connoisseur Media or its advertisers.
Revolution Healthcare Radio is brought to you by Home Helpers of Connecticut, in-home senior care services.
It's Revolution Healthcare, the show that keeps you in the know about the ever-changing healthcare system. We all need answers to our many questions about health and the revolution in healthcare. Presented by Patient Advocate for You, making sure that your healthcare is coordinated properly. And now, here is Sharon Gauthier, taking your calls and sharing information. 1-888-574-2723. 1-888-574-2723.
Good morning, everyone. Again, another beautiful Saturday. I can't believe that Christmas is next weekend. Hopefully everyone has their decorations up. We have this snowman on our front porch, and when it's blown up, it looks great. But as I drive through the neighborhood, I'm thinking to myself, it looks like a grave of blown up pieces when it's not blown up. You just have these drab, deflated animals and snowmen on the porch and on their grass. Listen, we decided that we were going to devote this week's show and next week's show to Home for the Holidays. As we were talking a lot in the last few weeks to my staff and my mentors, what we understood and what we realized is that everyone's going to be home for the holidays. I actually wrote an article on LinkedIn called I'm Fine, and I'm fine usually is what you get from your parents when you call them. So for all those families that are suddenly coming together for the holidays, what I wrote about was just be aware of what you're seeing and understand that I'm fine doesn't necessarily mean I'm fine. I'm very fortunate to be on the Brain Ball Committee, which is the Alzheimer's Association in the state of Connecticut. So the Alzheimer's Association last year had their first Brain Ball, which is kind of a nice little name for the fact that Alzheimer's is obviously related to your brain. But it's a fundraiser. It's their yearly fundraiser. Sharon Pope, who is an elder care attorney, has been the one spearheading this, and the Alzheimer's Association in Connecticut is very supportive of this. So I was very honored to be asked to be on the committee this year, and the Brain Ball will again be at the Science Center in Hartford, which was a beautiful place to have it last year, and it's going to be on Saturday, March 5th, 2016. So we'll continue to give you ongoing information about that as it arrives. So, Home for the Holidays, what does that mean? What that means to us is that families are getting together, and you really should be alert as to what's going on with mom and dad, and saying to you that I'm fine isn't necessarily exactly what's going on. I'm very happy to have Carolyn DeRocco on our show. She will be calling in. She's the Vice President of Education and Programs in the Alzheimer's Association in Connecticut. And she's going to share with us some statistics along with some programs. They've been very much in the forefront in the last few years, more than ever, because Alzheimer's, dementia, memory issues, whatever anybody wants to call it, is a very large problem in our country. As we spoke about caregivers a few weeks back with Nora Duncan, who is the regional director for AARP, who are very involved with caregivers. She spoke about the state of Connecticut. In this state, we have a half a million caregivers that are unpaid caregivers. So what that means is that we have families, neighbors, church groups that are volunteering their time to care for people with those memory issues. The cost of that to our system, if indeed they were paid, would be $5 million. And what does that mean to the rest of us? That means that we have to be alert to a public health crisis that will evolve in the next, 10 years, with a very large amount of people entering the world of dementia and needing care. And there are very little options out there for people when it comes to the government to help them. And I would caution everyone as the holidays are coming to be very aware of what's out there. I recently had a client, prospective client, who had called us, who was looking around for a caregiver for their father. We don't provide caregivers, but we connect, like with Home Helpers, who's one of our sponsors. We connect with caregiver agencies, companion and homemaker agencies in the state that really provide excellent or well-trained caregivers. Caregivers can be anywhere from a patient care assistant to a home health aide to a CNA. The levels of that are really not much different, other than you might have someone who has a CNA certificate. Unfortunately, the programs evolving around the CNA certificate are short. The people that they tend to attract into those programs are usually with less education. And it's been my experience that regardless of having that, you either have a good caregiver or a bad caregiver. There's really nothing in between. And it's a totally unregulated industry. There's 484 non-medical homemaker and companion agencies in Connecticut. But what's coming to my attention is that they're going into a medical model. So as families are rallying to try to help their parents who may already be in a crisis, and the discharge planner from the hospital or the convalescent home says to you they cannot go home without help, be very careful as you start to Google that kind of help as to what you're looking at. If you see someone that says they're a home care agency and it truly looks like a medical model, meaning that they say that they manage certain disease states with experts, there are no experts with disease states whatsoever. There's only one company I know of, Companions and Homemakers in West Hartford, that has really embraced having their aides go through a program that is provided by the Hebrew Home to be certified in dementia training. And they've invested in this by actually paying for that training. But that's very unique. So if they're telling you that they have experts for Parkinson's, dementia, diabetes, whatever that may be, they're not. If these companions and homemakers registries, and how you can tell that is when you ask them their number, their registration number, it is not a license. There is no licensing process, and I know I've talked about this before. So to be licensed means you have a process and you have demands put on your agency to prove that you can meet that licensing. A registry is exactly that. All you do is you go to the Department of Consumer Protection, you pull up Homemakers and Companions, you fill out the form, you pay $150, and you register your name. That is the end of it. There is no involvement or control or anything from the state level, because that's the way the law reads right now, that is involved with knowing what you do, which gives a lot of these companies a lot of leeway, and unfortunately, many of them are lying to you. And because no one knows what the rules are, those lies can become truths to the families that are in crisis. So again, if they give you an HCA number, that number has to do with home care, homemakers and companions. It is not a license, it is a registration. If they tell you there is a director of nursing, there is no director of nursing in a companions and homemaker agency. And that's what I ran into this week, is that the director of nursing of this particular agency, that's a franchise across the country, and maybe in other franchises in other states, they are allowed to have nursing and they are skilled. In the state of Connecticut, they are not. Therefore, showing up as the director of nursing when there are no nurses in that agency is wrong. And I want to protect the name of nurses. I want to protect registered nurses, and I'm working on that. That it's become a passion of mine, and the reason I got involved is really showing up in some of these homes and seeing the agencies that are involved. Most of them are ones that aren't franchises, that just did what they were supposed to do, which was registered. And it is unbelievable what goes on in these homes. People are having things stolen from them. There's no continuity in that there's aides coming and going. They're dressing inappropriate. They're representing themselves poorly in the community. And they're really taking advantage of that elderly person. And oftentimes it's with families that are out of state. So again, I caution all of you to please be aware of what you're getting into. And if you have any questions, I am more than happy to answer them for you. Or you can certainly call the Department of Consumer Protection. They are all over this and starting to look into this. There will be more discussion about this in the coming year on the state level, and just know what you're getting into. Not to say that any of these agencies are trying to harm you, but what they're trying to do is make you think that they are a medical model when they are not. And it's really unfair to the agencies like, home helpers, Always Best Care, Companions for Living, many of them that do it the right way. They cannot compete, nor is it fair for them to compete with another agency that goes in and says we have a director of nurses, yet supposedly there are no nurses to direct. So that's the end of my soapbox this morning. We do have coming in and calling us again is Carolyn DeRocco. She's the Vice President of Education and Programs at the Alzheimer's Association in Connecticut. We're going to talk a little bit about what families should look for. It's just to let you know that Alzheimer's is the only cause of death in the top 10 in America that cannot be prevented, cured, or slow. 45% of the people with Alzheimer's disease or their caregivers report being told of their diagnosis. Only 45%. Yet more than 90% of people with the four most common types of cancers have been told of their diagnosis. Almost two-thirds of Americans with Alzheimer's disease are women. Seniors die with Alzheimer's disease or another dementia, 1 in 3. Those are pretty wild statistics. So when we come back, we're going to be joined by Carolyn DeRocco. Thank you for listening to Revolution Healthcare Radio.
For over a decade, Home Helpers has been making life easier for those in need.
I was very impressed when we first met. So why don't you tell me a little bit about the reasons why you actually got into this?
For me, it's personal. I took care of my aging parents who wanted to stay at home. We actually had a good experience having a home health aide come in and give us respite to make it as comfortable as possible, keep them in control, keep them at home, which was very, very important to my family. Home helpers share that same vision. We picked home helpers because they're extremely strict about the quality of care, the training of the caregivers. They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Home Helpers is a franchise in Connecticut, and what I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Welcome back, everyone. You're listening to Sharon Gauthier from Revolution Healthcare Radio. We are going to be joined shortly by Carolyn DeRocco, who's the Vice President of Education and Programs with the Alzheimer's Association in Connecticut. And what I was talking about is the caregivers that people are going to ultimately need to help their parents at home. And the other thing we are talking about this week and next week is really about coming home for the holidays. Home for the Holidays series will be this week and next week. And today we just want to talk about that when you're home for the holidays, we really want families to be cognizant of what's going on. So I understand Carolyn has called in, so let's bring her into the show. Good morning, Carolyn.
Good morning. How are you?
I'm wonderful. Thank you so much for coming on our show. I know I kind of re-reeled myself this week in what our show would be about, and we all decided this is a great opportunity for you and our show to let our listeners and everyone know what to look for and what Home for the Holidays is. Our number, although I'm sure everyone's out in this weather, but our toll-free number is 888-574-2723 if anyone would like to call in. So, Carolyn, tell us a little bit about your role at the Alzheimer's Association.
Sure. I'm the Vice President of Programs and Education. I have been with the Alzheimer's Association for 9 years. And it's a wonderful opportunity to share with people diagnosed and also their family, caregivers, and friends that they do not have to take this journey alone, that there is absolutely support, education, and strategies that we can help make the quality of life better for both the person diagnosed and the caregiver.
So I was telling them a little bit about the brain ball and the fact that I'm very honored to be on the committee. Before you and I start sharing some information, I am pulling up from the Alzheimer's Association some statistics. So there's an estimated 5.3 million Americans of all ages with Alzheimer's disease in 2015. Almost 2/3 of Americans with Alzheimer's are women. Of the 5.1 million people ages 65 and over, Alzheimer's in the United States, 3.2 million are women and 1.9 million are men. Although there are more non-Hispanic whites living with Alzheimer's and dementia than people of any other racial or ethnic group in the United States, older African Americans and Hispanics are more likely than older whites to have Alzheimer's disease and other dementias. So this was pulled up from the website, which is alz.org/facts. For our listeners who want to look at that. Those are pretty compelling statistics and a little scary, Carolyn.
Absolutely. And again, we have new information each March that comes out. And we have a wonderful website if somebody wants to get more information on what the statistics are, what is the current research that's happening. Over 73,000 people right here in Connecticut dealing with this disease. So it's too prevalent. We need to do something about it, absolutely.
Well, and as I spoke earlier, we had Nora Duncan on our show, and I know that you're very familiar with her from AARP, who has really embraced the caregivers in our state and was pivotal in the legislation that was passed through for the caregiver bill, which we've talked about a few times, which is a start, but not going to solve all of our issues. But the caregiver bill, are you aware of what the caregiver bill is, and can you tell us a little bit about that?
So in particular, about the respite program, do you mean? Or
No, what she was talking to us about is that now when people go to the hospitals or they go into any entity, convalescent homes, but mostly hospitalizations, the hospitals are now mandated to ask them for who their caregiver is.
Okay, yes, and there's been lots of work. There's an SB 179 bill that speaks really to that as well, with education and making sure that facilities who have places of that have units caring for people with dementia, and even hospitals now are having to recognize what is the symptoms of dementia when they're coming in through the emergency room and when they're admitted. So lots of movement legislatively in Connecticut with caregivers and with professionals, and diagnosing and recognizing and making the best quality care for people with dementia.
And that is a very important item, I think, because most of the time when we get involved with people, they absolutely will deny the families that there's any dementia involved. Unfortunately, or fortunately, what happens is that when people are in their own environment, they can really hide a lot of those symptoms. Excuse me. For families that live out of state, I wrote an article on LinkedIn called I'm Fine, and that often is what they will get when they call someone and that are confident that, oh, mom and dad say they're fine, so everything must be fine. So if you can share a little bit about, what families should be looking for when they do come home for the holidays, which is the theme of our show this week and next, and what I'm Fine really means or doesn't mean.
Sure, and absolutely. Sometimes a 15-minute call on the phone, the person can seem fine. But I think looking at a couple of different areas. One is when you visit somebody, take kind of assess the physical environment. How is the temperature of the home? It may be very, very cold and the person's not realizing that. Or it could be the opposite. It's very, very hot and they're wearing layers of clothing. I often would say, take a look in the refrigerator. Is the food spoiled? Has it been there for a while? It would be important to take a look around. Are there bills piling up that have not been paid, or maybe stamped but not mailed, or mail coming in that's not been opened? Also, I have had, worked with many families in support groups, and some of the stories of where items have been found. So the remote is in the shoebox, or you might be finding items in odd places. I had one person that his shoes were in the oven. Thank goodness the oven wasn't on. But some of these things, so I think definitely looking at the physical environment, also observing the person. Are they dressed appropriately for the season? Also, one of the warning signs is that memory loss. Are they, sometimes they may not remember somebody's name, so they say, oh, hi, sweetie, hi, hon, because they can't retrieve that name. It would also be looking at, are they repeating the same question and telling the same story over and over? And often it's not that there's several people that come in and you're sharing the same experience, but you'll hear that the story is almost, said verbatim, so that as if they had never told that story before. Also, I would take a look at, are they having difficulty with familiar tasks, something that they were used to doing, making a pot of coffee, and now, they're making tea because, coffee is about 20-something steps, and it's too hard to do that. Is the food tasting right? Maybe they're forgetting to put things in the recipe. So certain things like that. One of the things I also would suggest for families, we often will say, well, does mom or dad, know their address and their phone number? Can they call 911 if they had to do that? And we say, really ask them that question. Don't just say, oh, yes, they said yes. Ask them for their address. Ask them how would they go about calling the police if they needed. And also, do they recognize what a smoke detector sound means? Do they know that that's something to be alerted by? So I would look at the environment, assess the person, and then also assess the other caregiver. It may be that your dad is taking care of mom, and dad looks exhausted because now he's doing all of the other chores that mom used to be able to do. So that's another way to see how much is he really taking on, how much is the other partner taking on in the role.
And I think understanding, those are really great ideas, and some of them I hadn't even thought about. When we go in and do a thorough assessment, those are some of the questions that we ask, and you're absolutely right. What I find is a lot of times the families will be there and start answering it. So I need to talk to families ahead of time and say, although it sounds like a silly question to ask them, it certainly is an appropriate question to say to them, if something happens, what would you do? And then I would get back from them, well, I would call for help. But then bring it one step further and say to them, well, how would you do that? So one particular woman who was 92 actually had Lifeline around her neck, and she wasn't even aware that she could push that. So what she said to me was, well, I would go to the phone. Well, then what would you do when you went to the phone? And she didn't know. So the daughter was quite surprised by that because her sense was, well, we got my mother Lifeline. Something happens and it's just going to go off. But her mother, again, didn't understand the steps. And I often explain to people that the activities of daily living that we all take for granted, that we don't really look at with mom and dad, are stressors for them. So for someone who's got, like you said, some memory issues, some of the problem is that they're getting up in the morning, getting dressed, washing themselves up, brushing their teeth, going to get something to eat, are things we automatically do that don't have those memory issues. And those become very complicated for someone with a memory issue. So when they're missing some of those steps, I'm glad you brought up clothing. When I was involved with running a very busy physician practice, I would talk to my staff about the fact that we had this, it was in New Britain, so there was this woman that constantly came in who was in her 80s, and the staff was almost annoyed that she kept coming in. So they brought it to my attention, and I sat down and talked with her. And what was happening is that this woman had lost her husband. She was Polish. It's a very Polish-dominated city. And her safety net to her was coming to her physician's office. She never really had any valid complaints. But the first thing I noticed is that it was winter and she was in summer clothes. Yeah. So that is an absolute big red flag for people. And as we sat down and we got a Polish interpreter for her because her English was broken, what we found was that her husband had died, her children didn't live in this country, she had no food, she was totally confused. And so everyone needs to be alert in every industry they're in that although you run and have very busy practices out there, especially the physician practices today that maybe are seeing 25, 30 people a day, just be cognizant rather than be annoyed. And the same thing with the ERs, rather than be annoyed with that person that keeps showing up. And I do find the emergency departments actually to be pretty alert to this. Try and figure out why they're showing up. It may not be because of a medical issue. It may be because of what exactly you're talking about. We're talking to Carolyn DeRocco, who's the Vice President of Education and Programs for the Alzheimer's Association in Connecticut. Our number is 888-574-2723. So, Carolyn, you know, one of the concerns that the government has are these private caregivers that are your neighbors, that are the family members, the husband that's taking care of his wife. And I really think, and you can expand on this, when for whatever reason, children are really afraid of their parents. It just amazes me that when we get into conversations about driving or anything that may impact the independence of their parents, but truly is protecting the independence of their parents, they're very resistant to confront them, and that's really the wrong term, but they won't have that discussion. So do you have a few tips as to how families can be comfortable having these discussions now that they're home for the holidays?
Yes, so, and I'm glad that you brought up the driving, because, you know, we all think about when we first got our license how that was our independence. So we do know that somebody who's diagnosed with dementia, they will eventually lose the ability to drive safely for two main reasons. Depth perception, so how far is that curb, how far is that stop sign? Also wandering, somebody can wander in a car and get much further if they're wandering. Their judgment is impaired, so it becomes a safety issue. We have a wonderful book that we would be happy to give from the Hartford. It's How to Have the Conversation with Dementia and Driving, and it talks about it's a wonderful checklist for the caregivers where they can kind of assess, you know, are they seeing little dings in the car? Are the side view mirrors bumped? You know, is somebody who takes a half hour to come back from the store now taking 45 minutes because they've taken a wrong turn? So it gives the caregiver like a checklist for themselves to use, so they're not just thinking of these ideas on their own. And there's also a letter that you could have the conversation, a promise, kind of a little contract with the person. You know, I think what's very important with driving is that if you're going to have that conversation, and you need to think about who is the best person to have that, is that if you're going to somebody who used to go to church every Sunday or went to the movies or went to the bridge game, who's going to replace that? So what happens is the person is now not the driver, they're the passenger.
Right.
And I think when you have that conversation, if you give them who the passenger, you know, who the driver is going to be, that helps with that discussion, because they still want to socialize, they still need to get out. So who are you replacing there? And I think that helps the conversation. But if you call our helpline, it's 1-800-272-3900. We can send you information specifically on that, but it's a wonderful resource guide.
Well, I think driving is the number one issue that people have to talk to their families about. And you're right, you know, it's a big safety issue, but the other issue that comes into play is that now the family is responsible to try and find a way for the transportation that no one had to be responsible for. So rather than there being an issue with it, just open the conversation before it's a problem. For me, being an old ER nurse, I was often on the other side of seeing those terrible accidents that would happen. We read them in the paper all the time, where some elderly person has gotten into a crash, and ultimately that person is the one who isn't the one that gets hurt. It ends up being someone else. So when we come back from our short break, we're going to continue our conversation with Carolyn DeRocco. You're listening to Revolution Healthcare Radio. This is Sharon Gotha, your host, and our number is 888-574-2723.
For over a decade, Home Helpers has been making life easier for those in need.
I was very impressed when we first met. So why don't you tell me a little bit about the reasons why you actually got into this?
For me, it's personal. I took care of my aging parents who wanted to stay at home. We actually had a good experience having a home health aide come in and give us respite to make it as comfortable as possible, keep them in control, keep them at home, which was very, very important to my family. Home Helpers share that same vision. We picked Home Helpers because they're extremely strict about the quality of care, the training of the caregivers. They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Home Helpers is a franchise in Connecticut, and what I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Welcome back, everyone. You're listening to Revolution Healthcare Radio, and I have the honor of talking to Carolyn DeRocco, who is very involved with the Alzheimer's Association, is Vice President of Education and Programs. Our number is 888-574-2723. We actually have someone calling in. We have Carl from West Hartford, Carolyn, calling in. Hi, Carl. How are you? Carl, how are you?
Doing fine, thank you.
Well, thank you.
Day.
It is a beautiful day. I can't believe it's Christmas, honest to goodness. So, Carl, we have Carolyn on our show today also. Thank you for calling in. Did you have a question or a story?
Yeah, I have a question. How do you deal with the doctors that won't talk to the spouses or relatives about the patients?
Well, on what level are you talking about? So there is a legal piece of this in that if you have parents, you would need to make sure that the parents have allowed and signed HIPAA paperwork with the physicians to allow them to talk to the families.
How do you tell your spouse's doctor that they're starting to show serious signs of dementia? They won't talk to you.
Carolyn? Is Carolyn there?
Yes.
Carolyn, what I have a few suggestions, Carl, and then Carolyn can kind of fill in. I think that doctors are very apprehensive, although becoming much more aware of dementia and concerns. If you're having a hard time getting a hold of the doctor, my suggestion would be to make an appointment. Speak to the office manager. If they are lucky enough to have a nurse in that office, be very persistent about it. Make an appointment with your mom or dad and go in with them or the person you're concerned about. And go in with them and then talk to the physician in front of that person and just say, because it's not a big secret, and there may be some resistance, but you can do it in a way that says you have some concerns about their memory and you wondered if there was any testing or evaluation that can be done, which there are, some minimal testing that physicians can do. You know, unfortunately, there are not a lot of options for expertise except for geriatric psychiatrists that really just manage medications for people with dementia or memory issues and can do an evaluation. But here's the problem. A lot of your primary physicians will say, we'll make a referral to Dr. So-and-so, and it will be months before you get an eval. Even if you call Hartford Hospital's Institute in Aging, you will get the same response. So it is very difficult and challenging, and I don't know if Carolyn has any more advice because she certainly is an expert in this field.
Definitely I have, this is not, you're not alone there, Carl, and many families have shared this frustration. So I often suggest sending a fax to the doctor prior to a visit so that you're letting them, you're writing down what you are seeing at the home or your interaction with your loved one, because a lot of the diagnosis process is what are you telling them? What are you seeing in the person? Because sometimes a 15-minute visit, the person could be, having a great day. So faxing the information, you can absolutely call the doctor and have a care consultation yourself to discuss the matters. I've had some families that will, again, and even in front of the person, sometimes using the words like we want to, the annual wellness visit should be testing cognition. And, you may sometimes, a softer language is to say to mom or dad, I want to make sure that physically everything is okay, and, we can do some testing to make sure that, your blood work is fine, and all of these things are fine, because they can affect your memory, your B12, your thyroid. So you're kind of included in that physical wellness, and they seem to have a more acceptance of that rather than saying, oh, your memory is not good, we want to get that checked. It should really be part of the annual wellness visit, looking at cognition. And also using the words, we want to rule out something that can be reversed. So, a thyroid condition, maybe they're not taking their medications right, and that's why they're having some dementia symptoms. So some of those discussions are a little easier, but absolutely speaking to the doctor prior or sending a letter. Some doctors, not many, but will take emails of what you're experiencing and what you're seeing.
And if there are multiple doctors involved with your loved one you're talking about, I would probably zero in on the primary doctor, who sometimes is not the one that they see as often. They may be seeing their specialist, who will always defer to the primary doctor. Carl, when we're done having our discussion here, please stay on the line, because I'm going to have Christian take your phone number. I'm more than happy to follow up with you to help you with any resources you may need with this process. I appreciate, as Carolyn does, first of all, you're recognizing the issues and wanting to be involved in it. And it is very frustrating for the families that are involved to try to get help. It's going to be a more expanded issue coming forward. But you're right. You want to preserve the dignity of your family, but at the same time, you want them to be safe. And I would say if there's a safety concern, look at what that safety concern is. Again, I'll follow up with you so that I can help you with getting some help in there, which there's a lot of help. There is not only help from the Alzheimer's Association, which there's a 1-800 number, that's a caregiver number that is actually 24 hours, and we'll give that out at the end of our show, but it is on the alzheimers.org website. In addition to that, in the state of Connecticut, there are many elder care programs. They're wrapped around, unfortunately, income somewhat, but because there's many levels, there is help that can be done if you know how to access those systems to get the evaluation. Also understand that if one of the people you're talking about is a veteran, is that, do you know whether that's true or not, or?
I've served, but I'm not a veteran, and she's not a veteran. She's a daughter of a veteran.
Okay, so
that gets.
That is, the VA is another place that people can go to if they are veterans. But like I said, it's a difficult conversation, and it's a difficult process to try to get the attention. But thank you for being on top of that and calling into our show. And like I said, I'm going to have Christian take your number, and I will follow up with you on Monday so that I can help you through this process.
Yeah. Just one observation is you mentioned email, doctor. As an IT professional for over 50 years, don't use email for that. It's insecure. It's easily hacked and cracked. Faxes are generally a much better, more safer idea. So I would reinforce that positively. And thank you for the idea of a fax to the doctor. That I had not thought of that. I've tried calling. I've tried talking to the nurse staff. I'm almost tempted to just go in there and sit till they talk to me.
Listen, that's another option that you can do. I definitely would.
And, the problem with that, though, is you start being assertive.
Correct.
They call security.
Correct. So,
you get thrown out and banned from the hospital. and this is a Yukon doctor, and they've got a new system and a new doctor's building, I guess, and it's just what my wife's told me already. It's total chaos over there, and they lie about having slots available for visits. It's like, there's nobody you can talk to.
Well, I actually have I have a pretty good relationship with many of the staff at UConn, and again, I will follow up with you on Monday and connect you to the people who can absolutely help you, because you should not be this frustrated in trying to get help, Carl, at all. And it's unfortunate, but these are the stories that Carolyn and I hear all the time. So again, I will call you on Monday, and we'll follow up with you so that I can get you to the right people. And I'm sorry that you're going through this. It's really not fair to anyone, especially someone reaching out for help.
Thank you so much.
You're welcome, Carl. Thank you for calling. Well, that was an interesting phone call from Carl, and he's absolutely right there. It's unfortunate to every system, in defense of UConn. It's not just UConn, it's every hospital system in Connecticut that is most difficult for people to access the right people. they see a lot of people in a short period of time. So what he's talking about, Carolyn, is very familiar to both of us in that people just don't know where to go. And primary physicians, even geriatric physicians who are, very loaded with patients all the time. I find it's very difficult to get in to see a geriatric physician whose expertise is elderly in order to have some of these assessments done. Is there any connection that the Connecticut Association has, Carolyn, to help people who really need to have a family member assessed and are running into the problems that Carl is running into?
So we do have a list of diagnostic centers and neurologists, geriatricians on our website, and also, again, calling that helpline number, speaking to one of our helpline specialists about that issue. Depending on where you live, we can help navigate that system for you. And I really want to appreciate his comment with the email, and I didn't mean putting lots of detail, just trying to set up an appointment to meet would be a better option rather than putting lots of information over the web. So I agree with that, and thank you for sharing that, Carl.
Well, and there's also, now with electronic medical records that I think are an absolute mess because most of the time or much of the time talking to different systems has become challenging within the system. So again, I think it's a great idea to have the electronic medical records, but it is going to be a learning curve for everyone as to how to access them, what information is in there, is the information correct. So I would also say to everyone that you do have the ability to have the office tell you how to access your records, and then you would be able to go in and look at your records and see what's documented, and also either challenge or question the documentation, because we have had clients with wrong diagnoses in their records, because behind that intake of data, of course, is a human being, and there are going to be errors that happen. So again, it's just a learning curve, and it's a team effort. And I think for a lot of people, having a team effort around healthcare is a new concept. For someone like your parents and mine, Carolyn, my mother just put physicians up on a pedestal, and there was never any questioning them. Now I think we've kind of gone all the way to the right in that they're not just questioning, but they're also being belligerent to some of the physicians that has created a problem. So we need to find a balance, right? We need to find a balance where we're part of the team that is either managing our family issues or managing our issues, and it continues to just be a process. Carolyn, do you happen to have that toll-free number that people can call by any chance?
Sure. For the Alzheimer's Association, it's 1-800-272-3900.
So as we talked about Home for the Holidays, which I really appreciate, and all of the situations that you gave us, I thank you so very much for your time on a beautiful Saturday that you took with us, Carolyn. Again, I will continue to mention the Brain Ball, which is March, what?
I don't have the date in front of me.
Hang on, I have it right here,
you
Carolyn.
Have it there.
Yes, March 5th. 2016 at the Science Center. The Brain Ball was the first last year, and it was just a fun night for you.
A wonderful event. Looking forward to it. We have so many events. I have the Education Conference coming in April. We have a Physician Symposium in June. So lots of wonderful things going on at the association. And we have lots of information specifically, on the holidays for gift ideas for the caregiver, gift ideas for the person with dementia, and we would be happy to send you any of that information, any of the callers, and if that can help you with your holiday season.
That is absolutely wonderful, and we will be having this particular broadcast on our website by Monday, so people will be able to listen to the information. And again, Carolyn, thank you very much. Go out and finish your Christmas shopping if you haven't. Enjoy the rest of your day, and I will see you at the next Brain Ball Committee meeting. Have a wonderful holiday.
Thank you for all that you do.
You're
Bye-bye.
welcome. Thank you, Carolyn. So that was Carolyn from the Alzheimer's Association. So appreciated her calling in, appreciated Carl calling in with his question and concerns that really everyone is faced with. I'd like to say hello to Dot. She's one of our faithful listeners, and hope that she's enjoying the holiday. And Dot, if you need anything, just let us know. We'd be happy to help you out. Our number here is 888-574-2723. So I was talking prior to Carolyn coming on about caregivers and families reaching out to caregivers. I do find that that industry, as I talked about, is totally unregulated. Please be very careful about what you do get. Understand that there are no medical models in a companion and homemaker registration. A very good friend of mine, Mary Jane Williams, who's part of the Connecticut Nurses Association, Peggy Sayers, who's a legislator. There's another woman who, unfortunately, I can't think of her name, but I'm going to try to look it up as we're talking because I don't want to leave her out of it, who is an APRN in the state of Connecticut also as a legislator. And our discussions have been around the fact that the caregiver organizations are truly on the brink of being very medical, and it impacts the nursing industry. And the reason why I feel it impacts the nursing industry is that when there is representation in a non-medical or a companions and homemakers agency, to me, I'm a little taken back by that because I feel very adamant about what a registered nurse does and what a homemaker and companion does is totally different. So there is a company in Connecticut, for instance, whose then their name is Nurse Next Door. So Nurse Next Door is a national company, and they come out of Canada. And at the end of all of this, my concern is that when I look at their commercial on television, they have someone who's fixing curtains and making dinner for someone, and the perception is that that's what nurses are doing. They don't have a nurse at all. It's a term that's used, and like I said, it's an out-of-the-country term. I don't know what they do in Connecticut. I mean, I don't know what they do in Canada. I know what they do in Connecticut. But it's worrisome to me that the perception is when someone is going to an agency like that there is nursing. I know as an agency they do have 1099 nurses that they pull in, which is questionable in my mind as to what control there is under that. So again, everyone just be very careful in when they're getting a caregiver in, whether it's an agency or a private person. We only have a couple minutes left to our show, so I want to thank again Carolyn for showing us a direction to go and telling us a direction to go with the Connecticut Alzheimer's Association. I want to thank Carl for coming in. I also want to thank Home Helpers this week. We had a very difficult situation with a client who's 91 years old, and he's a World War II veteran, and he is a Purple Heart recipient who's coming home with hospice, and Home Helpers has jumped right in to provide an aid for them that they need, went to their house to look at their environment, and also they also said that they, I'm just reading a note that my friend over here just gave me. They're also providing an aid and did an assessment of their house for them. I also want to thank Campion Ambulance, who is very kindly providing an ambulance ride home for this gentleman. And I say congratulations to them because an ambulance ride is not covered by Medicare. Therefore, the family would have paid upwards to $600 or $800 to get him home, which I felt was not appropriate. And Campion, Bill Campion, who's the owner and a registered nurse at Hartford Hospital, very kindly offered his services for this very wonderful gentleman going home on Monday. We only have one more show this season, which is next week. Next week is a holiday. I will say Merry Christmas, Happy Holidays, whatever it is that seems appropriate for your world, to everyone. We won't be meeting until after the holiday next week. We're going to review next week and take in phone calls from anyone who may have had some difficulty getting information about their families or finding out more how their home for the holidays worked for them. Anyone who's on LinkedIn can go onto LinkedIn and to our site, which is Patient Advocate for You. And on there, I do have an article that I wrote called I'm Fine, and the 10 things to look for before a crisis happens. I talk about the car, medications, the house, the bills and the money, as Carolyn had talked about. Look around and see whether or not the bills are being paid. Ask mom and dad, who pays the bills. And if they take out a big pile and there's a bill there from a year and a half ago, that's a little worrisome. How do they manage their money? I had a client who's now in a memory care unit who had $3,000 in her pocketbook and was walking around with that because every time she went to the bank, she would get cash and put it in her pocketbook. When she was moved out into a memory care unit because being home was no longer safe, the family, and I'd like to say hello to Cindy out in Massachusetts, the family found $34,000 in their home, hidden under the bed, hidden in boxes. So again, look at the money piece of it. The groceries, ask them, who's shopping for you? Is dad going shopping for you? Are you going together? What are they buying? Look at the car. If there's a lot of bumps and scratches on the car, I would be a little concerned about that. Look in the garage to see if they've hit the garage coming in and out, and start asking a few questions. Look in the glove compartment, please, because you may find several tickets that they may have gotten already that you're not aware of. So driving is a big concern for sure, and a time for all of you to start looking at that. Cognition and functionality, again, are difficult to assess because when they are in their own environment, truly, they can protect what is wrong with them or what is going on with them very well. But as Carolyn indicated, if they're just referring to the family members as honey or dear and are very vague about things, just push it a little bit more and start asking the questions. Gee, Mom, we're worried about when there's an emergency, what would you do? And if they don't know that, then that's a problem. You may have set up Lifeline for them, but what does that mean to them? Are they aware that they need to push that button? You don't want your mom and dad lying on the floor for days before someone happens to find them, because that creates a whole medical crisis for them. There are lifelines now that are motion detectors, so if at the moment that they become horizontal, it will go off. Talk to the neighbors. I think that's something that we kind of left out in our conversation today. I was speaking to a friend of mine, Ellen, that I happened to bump into yesterday. She was the nursing director from the nursing program I graduated from, and she lives down in Florida half the year and up here, and she was saying in Florida, it's just amazing to her how the entire neighborhood has picked up taking care of people, and families don't know about it at all. And so talk to the neighbors. They may be seeing things that you want to know about. Your mom may have wandered out in the middle of the night and they found them and brought them back, and they're not letting anyone know that. And that's what has happened to a few of our clients. So my wish for all of you is to have a happy holiday, a safe holiday. Please be aware of your resources. Please be aware what Home for the Holiday means. It does mean that families are getting together with their mom and dad or other family members, and just be cognizant of what's going on with them a little bit more than you might have in the past. And just hearing from them and saying, I'm fine, doesn't necessarily mean they are fine. And then know that if you do have concerns, you do have support. You can call that 1-800 number for the Alzheimer's Association that Carolyn shared with you. And you can also call our office if you'd like, or patientadvocateforyou.com, and the helpline number for the Alzheimer's Association. Again, you may not be diagnosed with Alzheimer's. There may not be a diagnosis, but clearly, if you are concerned about memory issues at all with a family member, please reach out to the helpline. They are a 24-hour helpline, and they truly are 24 hours. I've had family members tell me that they've actually called at 2 a.m. frustrated and have been able to talk to someone. That number is 1-800-272-3900, and we will put the Alzheimer's Association's information on our website, which is revolutionhealthcareradio.com, along with this radio show and all our other radio shows for people to access at any time. So thank you. Again, we have one more show before the end of this year. We're We're looking forward to next year, continuing to educate the public, bring forward the stories that people may not want to talk about, and also let everyone know that you're not alone in this journey. So thank you for listening to revolutionhealthcareradio.com. That's our website. Thank you for listening for Revolution Radio, and have a wonderful day, and we will talk to you next week.
For over a decade, Home Helpers has been making life easier for those in need.
I was very impressed when we first met. So why don't you tell me a little bit about the reasons why you actually got into this?
For me, it's personal. I took care of my aging parents who wanted to stay at home. We actually had a good experience having a home health aide come in and give us respite to make it as comfortable as possible, keep them in control, keep them at home, which was very, very important to my family. Home Helpers share that same vision. We picked Home Helpers because they're extremely strict about the quality of care, the training of the caregivers. They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Thank you for listening to Revolution Healthcare Radio. Want to learn more about the show? Visit revolutionhealthcareradio.com. You can also access old shows, learn more about our guests, and contact us with your questions.
Home Helpers is a franchise in Connecticut, and what I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Revolution Healthcare Radio, brought to you by Home Helpers of Connecticut.
Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Coming soon, the Revolution Healthcare Podcast. The people who never talk and the stories that don't exist. The podcast is a more intimate, in-depth examination of the personal challenges caused by healthcare. The focus is on the human aspect of healthcare, from patients and families to doctors and nurses. They all have a story that needs to be heard. The Revolution Healthcare Podcast is available early January 2016.
For over a decade, Home Helpers has been making life easier for those in need.
I was very impressed when we first met. So why don't you tell me a little bit about the reasons why you actually got into this?
For me, it's personal. I took care of my aging parents who wanted to stay at home. We actually had a good experience having a home health aide come in and give us respite to make it as comfortable as possible, keep them in control, keep them at home, which was very, very important to my family. Home Helpers share that same vision. We picked Home Helpers because they're extremely strict about the quality of care, the training of the caregivers. They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one. And well qualified to take care of someone's loved one. And well qualified to take care